something also equally very important. The Ghana Health Service has confirmed 10 new cases of MPOX, formerly known as the monkeypox, bringing the country's total case count to 19. According to health officials, 5 of the confirmed cases are currently on admission and are receiving treatment. No fatalities have been recorded so far in the latest outbreak. Here is a breakdown from the Ghana Health Service. All right, so new confirmed cases 10, total 19, new deaths 0, total deaths 0, on admission 0 as well. So this is the latest information from the Ghana Health Service. Now, the Ghana Health Service has assured the public that it is actively monitoring the situation and has intensified its monitoring exercise to ensure that people who have contracted are identified and given the necessary attention regarding this MPOX disease. Well, let's see if we can get some understanding of what the situation is. Dr. Alfred Kwesi Menya is a senior research fellow, epidemiologist, and implementation scientist at the University of Health and Allied Sciences in Ho. Doctor, good afternoon and welcome to the program.
Good afternoon, sir. Thank you for the opportunity.
So according to the Ghana Health Service records, we have 10 confirmed cases, bringing the total count to 19, but on admission is 0. Does it mean that people who have contracted it are receiving care at home, and are they not endangering other people who are close to them?
Thank you very much for the opportunity. The people who were identified through contact tracing, some were treated, and then those after treatment, they are free. And the 5 identified cases that are still on admission, they are going through the treatment. So per the Ghana Health Service protocol, after those people have gone through the necessary treatment, they are no more danger to the public, so they cannot be on admission.
All right. And so should I be worried about the way the numbers is increasing? Should I be worried that this may be widespread?
No, the public need not to be alarmed about this, because Ghana Health Service have a very robust system, especially when it comes to public health, and then when there is a disease like this, that the Ghana Health Service is capable of doing contact tracing. Early identification of the disease like this is what is critical, and that is exactly what Ghana Health Service have been doing. Identify the index case and has been able to follow up through contact tracing to identify those contacts. So I don't think we need not to be alarmed at all, because Ghana Health Service is in control, and then the appropriate public health structures are in place to be able to contain the situation.
And then evidence of pulse on the body, is that the only one, or the only thing that I should look out for to determine that person may need help, because that pulse may also mean something else?
Yes, that is not the only thing. If some of the symptoms include fever, severe headache, and then backache, muscle ache. If you are having any of those conditions, you have to quickly go to the nearest health facility for you to be checked. You don't have to wait till you're having those rashes all over your body before you go to the hospital. It is good that you report to anybody having any of this unusual severe headache, backache, and also unexplained fever. It is good you quickly go to the nearest health facility for you to be checked.
But are you happy with the level of public awareness on this by the Ghana Health Service?
Ghana Health Service has done a lot, and again, when you check on social media, you realize that they put a lot of information there. But I hope still a lot can be done in the general public by educating people about what to do, especially people who like a lot of bush meat. You know, the disease is transmitted when you have contact with animals, and then from the literature is transmitted through contact with animal or bush meat. So I think a lot more of education needed to be done to our people so that we'll be able to prevent the situation. But I believe strongly that Ghana Health Service is capable of containing the situation, so we need not to be alarmed.
Should there be total ban on the consumption of bushmeat, at least for now?
As an epidemiologist, I will suggest that we should be careful. Anybody should be careful in going for bushmeat at this time, because it may not be very safe doing that.
And this should be across the country, not just to a specific location.
No, you will not be able to know which animal in the bush in your area is having the condition. So I will encourage that the consumption of bush meat, let's be careful with it anywhere within the country, because you don't know which animal is coming from where, and then we'll be having the condition.
All right. Thank you so much, Doctor, for that education this afternoon. On the matter of MPOX, the Ghana Health Service says that they've recorded 10 more, bringing the total count to 19, but nobody is on admission. There's not been also any recorded deaths resulting from MPOX. But the caution here is that be careful and watch what you eat. Now let's talk about education, because at the Latimpa Basic School in the Northeast Gonja district, rising dropouts have turned teachers into door-to-door campaigners, moving through the community each day, pleading with parents to send their children to school. Emmanuel Jiveni report from Latimpa in our education series, Crumbling Starts.
It's 10 a.m. at Latimpa, a farming community in the Northeast Gonja district of the Savannah region. Inside the junior high school, the silence is deafening. The classrooms are nearly empty. Here, teachers do not just teach, they beg. Every morning, they come through the village, knocking on doors, pleading with parents to let their children come to school.
Sometimes you can come, some years are there, they will come 2, 3. The others will remain in town. You have to go and talk to them and they will come. And they can come at any time. So for that one, I know for sure they will come. For coming, they will come, because we will talk to them. We'll talk to them, and for sure, God willing, they will listen to us. They don't see the importance of education. So after junior high, and even let me say that maybe the parents too don't see the need.
What we do is sensitization. That's what we do, education, massive sensitization, house to house. So I do go house to house, they know me. Then we will tell them the need for them to come to school, unless, if for nothing else, the civilization alone is something that's a promising. And that will be different from what we are experiencing now.
The attendance sheet tells a painful story. JHS 1's register has not recorded a single student weeks after school reopened.
Some decided to run away to other places. Others remain in town. So for now, they are yet to come, because we are still talking to the parents to allow them to come. Because some are still in town, that they will not come.
In the previous term, the most consistent Form 2 students showed up just 32 times out of 60 days. Others barely made it for 20 days.
This small you are getting, if it is taken off again.
The teachers believe the reasons are many, but they all point to despair.
They see no reason, like a better practical reason why they should send their children to school. I want to say practically, like people who will be here for them to emulate. Whether from the community here, they have an eye opener that they can see, and that they will feel, let me also allow my children to go to school, so they become either a teacher, a policeman, or this and that.
Also, they looking at the structure of the school. It is also another factor, because when you look at the structure, no one will tell you that even a serious child or a serious parent will not like to bring the child to the school. The windows, the doors, even the ground, no even furniture, no enough furniture. So there are a lot of factors.
The classrooms are in poor condition. There are no role models for children to look up to. And parents say their children can earn more carrying loads in cities than sitting in the classroom.
We're having an engagement with one parent over why he's not sending is preventing his child from coming back to school. He said that you said, what do you have? We'll be here every year. We'll farm our yams and we'll buy brand new motorbikes. And what do you have? And everything you've been posted to this community. We've added this old motorbike up to now.
I'm a professional teacher. I have to teach because I'm paid to teach. But you've come to school and there are no students. What are you teaching? So that alone can demoralize you. And it can let you lazy. So
we got more of this in subsequent bulletins and of course on our website, joeonline.com. Well, folks, that's our show for today. For more stories, log on to our website. But there's this breaking news coming in from the offices of Yoko. We understand that the Ashanti Regional Chairman of the MPP, Bernard Nchibu, also known as Wuntomi, has been detained at the office of Yoko. He was picked up at the police CID headquarters after he had reported himself based on the bail condition that is on him yesterday after appearing before the CID. That is what we are picking from now. We'll follow up on this issue and bring you more in subsequent bulletins. But there's more stories on joeonline.com. If you go there, that's Mahama Yariga proposing constitutional amendment or removal of Superior Court judges, plus some other stories. The Ghana embassy was closed down yesterday. Will be reopened on Thursday in the United States of America, capital of Washington, D.C. Folks, whatever you are up to in the hours ahead, I hope is profitable. Same time tomorrow, we shall be here to bring you the midweek edition of The Post. My name is Elton Brobe. Good evening and take care.